You may not have felt any different, but when you turned 18, you legally became an adult. As an adult, you gain the right to vote, sign contracts, give consent for medical procedures, and control who has access to your medical information. With the rights of adulthood also come new responsibilities. Completing the transition process will involve a few more steps: transferring to adult-oriented providers, developing a good relationship with these new providers, establishing your new leadership role in managing your health care, and ensuring that you have ongoing health insurance coverage. To find a new doctor, you need to shop around. Ask everyone you know for suggestions. Set up an appointment when you're in good health just to meet the doctor and talk about your healthcare needs. If you don't like this doctor, try someone else. It may take some time, but be patient. Even after you find someone you like, it takes time to build a new relationship. Another big change is that you are now responsible for making decisions about your care. This can be an important and sometimes difficult change for your parents. After all, helping take care of you has been one of their major concerns for a long time. Encourage your parents to think of the change in decision-making as a promotion. They've been promoted from managers to consultants. For your part, remember that your parents have a lot of experience with your health, and they can be a great source of information and support as you take charge of making your own healthcare decisions. Paying for healthcare can be very challenging. At this point, you may still be covered by your parents' health insurance or some combination of public or private plans. Most likely this will change over the next few years. Keeping health insurance is very important over the next few years. If your insurance coverage depends on you being in college, then you need to be successful in school. This will also help you get a job that has health insurance benefits. If you qualify for public health insurance such as Medicaid, it's important to be aware of the rules and requirements that need to be met in order to continue receiving it. You do not want to find yourself sick with no way to pay for the care you need. Ask your healthcare providers for advice about maintaining your healthcare coverage. Transition checklist: taking charge. I can tell someone the effects that getting older may have on my disability or health condition. I can tell someone about medications that I should not take because they might interact with the medications I take. I am alone with the doctor or choose who is with me during healthcare visits. I answer all of the questions during a healthcare visit. I have identified adult doctors and facilities that I will go to when I leave my current doctors and facilities. I manage all of my regular medical tasks outside the home. I can tell someone what new legal rights and responsibilities I gained when I turned 18 years old. I can tell someone how long I can be covered under my parents' health insurance plan and what I need to do to maintain coverage. If most of these statements are true for you, you are taking charge of your health care and actively working on transition to adult-oriented health care. Growing up with a special healthcare need can present you with many challenges. However, young people with chronic health conditions and disabilities who were able to meet these challenges say that they had to do several things to be successful. They had to take responsibility for themselves, manage their own health care, and be as physically fit and healthy as possible. Healthcare transition takes time, planning, and practice. It involves becoming knowledgeable about your health condition, being responsible for healthcare tasks, and making healthcare decisions. It's about taking on new responsibilities, practicing independence, and finally taking charge. But most of all, healthcare transition is about building a healthy foundation from which to pursue your dreams.